Okay, a warm welcome to you. So I'm Reda Sadki from the Geneva Learning Foundation. Of course, I know many of you and all of you know me because we have invited to this meeting the ambassadors of the Nigeria TGLF alumni and alumni leaders from the movement for Immunization Agenda 2030, the full learning cycle from 2022, as well as other IA 2030 related initiatives. So this we are, first of all, just to say we're very pleased with Charlotte to be connecting with you for this. Some of you may remember that we hinted that there was something we were working on with UNICEF over a year ago. So we're really pleased it's finally happening, and it only makes sense. It's happening with you, for you, and it does not make sense without you. And so today is really a consultation focused on listening to you, also introducing the initiative, but introducing the initiative in order to hear back from you what you think about it, and what we need to do to further strengthen it. So first of all, the pre-launch schedule. You received the initial announcement as a member of the Nigeria network of the Geneva Learning Foundation and of the Movement for Immunization Agenda 2030. Today is a partner coordination call. Maybe that's not the exact name for it because I think it's actually called to action. So let me just change that. It'll become a partner coordination call, we hope. Now, applications are going to open in the coming days and by next Monday. So that's the next call that we'll have together. And then there are definitely some key dates. My fire truck going by. There's some key dates for applications. Now, first and foremost, if you attend these meetings, these consultations, which are starting today, but which will be happening weekly. I think they should also be in the schedule. Okay, they are here. Yeah, you do need to fill out to complete the application, but you will be reserved and guaranteed a seat in this initiative, in the what we're calling the Immunization Collaborative. Now, by attending these weekly Monday check-ins, so this one starting today is the 10th of June, then will be followed by 17th, 24th June, as well as 1st and 8th of July. And by documenting how you're contributing to dissemination, we will invite you to the leadership circle for this initiative. So working closely with TGLF, but also UNICEF and NPHCDA. And now, starting the leadership circle are the TGLF ambassadors. And you can see ambassadors are alumni who were inducted on the 2nd of August last year. And this followed a 4-week process of dialogue and action. You can see the official list of ambassadors. Let me see if, right. And I'm just checking the Q&A. Okay. I see a contribution from Abua Joseph Autry. Charlotte, I'm going to rely on you to stop me if there are questions. So you all know the numbers of immunization and the challenges of immunization in Nigeria. The Immunization Collaborative is really about coming together and for the Geneva Learning Foundation, UNICEF, to support you and NPHCDA in doing so. So again, this is, of course, the Geneva Learning Foundation, but we're working closely with the NPHCDA and UNICEF. So first question for this consultation around who is this for is really to hear what is the biggest challenge that you face. And really, this is the key question because we are talking about peer learning. And this is going to be a rapid exercise in which you will be learning from each other. Want to know not only what is the biggest challenge that you face, but also do you think others can help you with this challenge? So I'd like to ask you to raise your hands. First of all, for everyone to write their biggest challenge, your answers to this question in the chat, and also raise your hand if you would like to specifically speak to this. And of course, if you recall, in the Movement for Immunization Agenda 2030, many of you, we started with the biggest challenge. So many of you who participated in the activities of IA 2030 remember, this is the starting point, and that was a global initiative with 99 countries participating. This is going to be entirely focused on Nigeria, but again, it only makes sense if you want this to happen and if you support this. So I'd like to, yes, Abdul Malik Yusuf, the floor is yours. I'm asking you to unmute.
Good afternoon, everyone. Hello.
We get you loud and clear. Please go ahead.
My name is Dr. Abdul Malik Yusuf from Sokoto State, Nigeria. First of all, I want to thank the organizers of this meeting for the opportunity given to us to participate and share our experience and also learn from our colleagues. So my biggest challenge of immunization here in Sokoto State revolves around combination of logistical, socio-cultural, and infrastructural issues. So I want to, because of the time factor, I want to summarize my points in a concise speech. The first of all, there is this issue of geographical and infrastructural barriers. Because Sokoto State is located in the northwestern Nigeria, so there are some remote and hard-to-reach areas. So these remote and hard-to-reach areas have a poor road network, making it difficult for health workers to deliver vaccines. Also, we have another challenge of inadequate health facilities, because many health facilities lack the necessary infrastructure and resources to support effective immunization campaigns. Also, there is this issue of cultural and religious beliefs. One of them is the vaccine hesitancy. Because of the misinformation, mistrust, and rumor about vaccines, often influenced by cultural and religious beliefs. This led to reluctance among parents to immunize their children. Also, there is this issue of community resistance or community non-compliance, whereby certain communities are resistant to external health interventions due to historical mistrust and other governmental and non-governmental from governmental and non-governmental organizations. There is also a logistical challenge where we have inadequate cold chain management, because as we all know, vaccines are required to be stored and transported at the correct temperature. So inadequate cold chain management is also a big challenge, coupled with absence of reliable electricity in the region. Also, there is a supply chain issue in terms of distribution of the vaccines to the remote areas, which led to delay. And we have another challenge of a shortage of trained healthcare workers is also a challenge. Then we have a high turnover rate also. Yes. Retaining skilled healthcare workers in rural and unserved areas is difficult due to poor working conditions and limited incentives. Another point of challenge is the socio-economic factors like poverty. High levels of poverty most at times limit access to healthcare services. So it's another challenge. Then we have education and awareness. As we all know, most of the remote areas in the northern Nigeria, they have low literacy rates and limited health education, which contributes to the lack of awareness and also for them to know the importance of the vaccines. Then the last point I want to talk about is political and administrative issues. In other words, political interference from the government. Yes, inconsistent policies and funding from the government really affects the programs, which can lead to gaps in the service delivery of immunization. And we also have coordination challenges between the various stakeholders and the
Abdul Malik,
government
Yusuf, thank you.
agencies. Thank you so much.
That's a very
Thank you
complete
so much.
inventory of challenges. The second question you see on the screen is, and I'm sure there are others, the key will be, of course, in this exercise will be to prioritize them and focus on one. But I would like to ask you for a short answer to the second question on screen. Do you think others can help you with this challenge?
Yes, sir. I can learn from other colleagues based on their experiences from where they are working from. At least we can learn from them and adjust in our strategies.
All right, thank you very much indeed. All right, we do have a lot of information we want to share with you about the proposed exercise to get your feedback. So I'm going to proceed. I thank Muhyiddin
Thank you so much,
Olalekan,
sir.
and of course Yusuf. Let's see, yes, Muhyiddin, who has shared major challenges, as well as, let me see if there are others. Yes, and I do see Jiniri Blessing, yes. Yeah.
And Okolo Onyinye.
Okay, wonderful. Now, we see you, if you are here, it's because you were selected by the Geneva Alumni Foundation. We invited you to join us today as we began to consult you, to listen to you, to learn from you, and to get this initiative launched together. And there's a key message which we hope to convey, and we need to get this key message right, which is why you or a potential participant matters. And so you can see here on screen what we've put. You're the first to see and understand the health challenges in the community you serve. And this is speaking to people at the community level, so it is less directly relevant if you work at a upper level in the system, at state or national level, but the principle is the same. The second key message is, again, to ask if you face any of these challenges. And there I would like to ask you to type yes if you recognize a challenge that you face on this list. Just go ahead into the chat and type yes if you see any of these challenges. So it looks like no one has children who have not been vaccinated in their community. Okay, thank you, Rabiu, Tracy, Kasim. So it looks like 3 Nigerians, 4, 5, 6, 7, 8. Okay, yep. All right, it looks like 9 Nigerians in this room are facing these kinds of challenges. Children who have not been vaccinated, who have missed vaccines, outbreaks of vaccine-preventable diseases like diphtheria, measles, or yellow fever, people in the community who do not trust vaccines. If you recognize yourself in any of these, type yes into the chat. Communities that are hard to reach, barriers that make it hard for some people to get to. And then, do any of you work with people in remote, rural, or hard to reach areas, or people in cities, people affected by conflict, people who move around a lot, like nomads or migrants, refugees or displaced people? So again, type yes if you recognize yourself in any of these. And if by the end, after having seen both of these lists, if you have not said yes to any of these questions, so it's just, if you don't work with any of these groups, then probably this initiative is not for you, okay? Just to be very clear. Now, it does not matter what your job is or where you work or who you are. What matters is that you join because you want to make a difference for the children and families of Nigeria. So to put this call to learning, call to action to the test, we now ask the next question. Let me see. So we have Rabiu, Kasim, and Mustafa, and I believe we need a in line with our rules about speaking in our meeting, Charlotte, I believe we should listen to a woman next. So we do need a woman to volunteer to raise her hand so that we can ask you this question. After having heard, based on what you've heard so far, will you apply to join this initiative? You've seen the, just as a reminder, the dates. So you see, let me see where, actually here. We will start the 15th of July, so in just about a month. And the question is, will you apply? Why or why not? Over to you, Charlotte.
Thank you, Reda. So while we are waiting for women to speak, maybe we'll bend to raise hands. Maybe we'll bend our rules a little bit and see if we can invite Rabiu or Kasim, the first person to unmute, should be able to respond.
Good afternoon.
Okay. Afternoon, Kasim, and please do not forget to introduce yourself.
All right. I'm Kasim Musa, where I'm coming from Borno State. I'm currently working in one of the hard to reach and working with the displaced population in Borno State. Those displaced population that were displaced due to the Boko Haram insurgency. So I would like to share some few of the challenges we face in a security challenge and remote working environment, which
Sorry,
are tied.
Kasim, the question, we are in the second question now, which is, will you apply to participate in exercise? Why
All
or
right.
why not?
Yeah, I will apply. The reason why I will apply is because of the environment and the condition I'm coming up, meet up with one of the criteria you listed above, which says about working in a hard to reach environment and also working with IDPs and conflict environment, which I'm coming from Borno State. I'm directly impacting and directly working with some IDPs in Borno State, which they have been faced with so much challenge with regard to immunization. So my answer is that I will apply because of the current situation I'm seeing and the current challenges of immunization in Borno State. Thank you.
Thank you. Thank you so much, Kasim. Now I want to turn to Chinyere Blessing or Fanny. Are you able to speak with us? I hope we can hear you now, because before we weren't able to.
Hello, can you hear me?
Yes.
Okay, it's good afternoon from Nigeria. So my name is Chinyere Blessing, and yes, I will want to apply. The truth is that when it comes to routine immunization, over the years we've been going back and forth, and the challenges are still there. So I really think I will have to apply and see how colleagues will help share their own ideas, and if we can actually make a headway, especially to reaching the underserved, and just make a headway when it comes to routine immunization in Nigeria. And yes, I will apply. Thank you.
Thank you, Chinyere Blessing. Reda, do we listen to one more person before moving forward?
Yes.
Okay, so we have Rabiu, over to you. And please do not
Okay,
forget to
hello, Reda and Charlotte. Good afternoon. Good afternoon to you all. My name is Rabiu Abdul Wahab, and I'm working here in Bauchi State, northeastern Nigeria. I will apply for it because it's a continuous learning, and what we have learned throughout the Alumni Ambassador, throughout the immunization agenda, we apply in the field of our activities, of our routine work, and we see a positive impact toward reaching the 0 dose and other missed child and other, even in the conflict environment in our state. So I will apply again and continue learning to keep pushing until we deliver, until we reach all the underpipe children with the vaccine, so that they will be immunized and be free from the disease that are subject to the immunization. So thank you so much. And I'm really been happy to be in the next line. Thank you.
Thank you very much indeed. So there's another question which we'll ask after getting through a little bit more of the information about the call. And it is this one: how will your colleagues respond to this call to learn and lead? So obviously, if you were invited to this meeting, is because we consider you to be part of the inner circle of leaders of the Movement for Immunization Agenda 2030. Many of you are also became ambassadors on the 2nd of August 2023. But how will your colleagues respond? We need to grow the circle of health professionals, health workers who are involved. And we need to figure out that most of your colleagues are probably not like you, not as dedicated, not as committed, not as engaged. And so we need to figure out how we're going to move them, prompt them to action for the children and families of Nigeria. So the next question is why you should apply, and I think this is more about how to apply. So first of all, there is a link, and we're pleased to share. We shared it. It was we've been holding back this link, but you can actually go and look at the call for applications, the call to learning, and this is not just an application. The application is not released yet, so the page is available, but you will receive a notification if you register on this page. You'll receive the notification, and as I said, those of you who attend these preparation and consultation meetings and support dissemination will, of course, be automatically accepted into this peer learning program. However, you still need to share to complete the online application. It will not be as long or as detailed as the IA2030 movement application, which I'm sure many of you remember. And thank you, Okolo Oninye, for this saying. So you are from Anambra. Yes, I will apply because I have passion to help people prevent outbreak of diseases, and the people I stay with really need this support. So what you need to participate is very simple. You need to be willing to learn and work with others. And we know that is not everyone. Some people are perfectly content doing what they're supposed to do and no more. So this program is not for everyone. It is for those amongst health professionals who want to go, the extra step, the extra mile, who are not afraid of getting grease on their elbows. And we know, again, if we invited you, is because we know that you are amongst those who are willing to go the extra mile. And you already have, in the Movement for Immunization Agenda 2030, in your activities as ambassadors. But we do want to extend the circle to help to find more health professionals who really want to make a difference. In practical terms, there's more information here on the page. So there is a lot of information on the page, which is also why we'll be having an information briefing for applicants and potential applicants very soon. So next question is, for those of you who have looked at the announcement, we're going to lower all hands, I think. Let me just, so you can start fresh. For those of you who have read the announcement, how can we make the announcement easier to understand? If you have any questions, anything that you're not sure about at this stage, then this is the time to ask. So please type it in the chat, and if you raise your hand, we'll of course turn to you to speak. Okay, so a great question from Okechukwu Ogodire. So this is in the Q&A. Thank you. Actually, I've been saying the wrong thing. It's not type your question in the chat. It's type your question in the Q&A. So Okechukwu, you ask if it's only those that have experience in the health sector who should apply. So if you are involved in immunization in some way, then this program is for you. So there are many ways to be involved in immunization without being, strictly speaking, a health professional. So that is for you to make that determination. Certainly, we will consider all applications that we receive. And so I don't know if you were referring to yourself or to others, but that would be my my answer. So anyone who would like to contribute on this, how do we make the announcement easier to understand? Raise your hand. If you would like to speak to this question, will your boss support you in applying and participating? Why or why not? So this is, we don't know your boss, but you almost certainly do. So, all right, I believe that's from Ismail Sidi, who says yes to that question. Is that correct? And Ukamaka Okafor says, in addition, I am passionate about using increase in immunization coverage to address the epidemic of antimicrobial resistance. So Charlotte, please do stop me if there are raised hands. We'll keep going with the questions. Think about these. If you want to speak, if you want to share, write in the chat. If you have a question, put it in the Q&A.
We have to raise
Fatima. Yep. Go ahead, Fatima.
Fatima, you have to unmute.
Yes, I've unmuted myself. Thank you.
Okay,
President, my name is Fatima Zara Abubakar Otaro. I just wanted to introduce myself. I'm from the education sector, which is I teach the community health workers that basically involve themselves with going to the field. So that means I am not on the field. I am in the classroom. Can I register, or is only those that are going to be on the field?
So we will ask you to identify a local challenge that is of concern to you, and then to analyze the root causes of that local challenge and map out actions you will take in response to that local challenge. My suggestion, so you are of course welcome to apply. My suggestion is to look at, if you are, because you are involved with in-service training of health professionals, would be to think about, to look at challenges there and to see if there's an interesting project and analysis of the root causes of the challenge you face in the realm of education. But certainly we do not disqualify or exclude anyone who is involved in immunization at any level, in any way, and who wants to see things get better for children and families.
Okay, thank you.
And then I think there's another question. So Nasir Tsafe, who says, what kind of proof must we produce to TGLF regarding the boss's approval? So just to be very clear, we trust you, we believe in you, and it will be, we will ask you, do you have a support from your boss? If you say that you do, you will be accountable to your boss. Yes, should there be a problem, but we believe you. And what we want to convey, because this is in partnership with UNICEF and NPHCDA in Nigeria, this is not some initiative on the side, and this is also different from participating in the global movement for Immunization Agenda 2030. So we do want to make sure that that your bosses will understand and support you, but we know that is not always the case. Okay, take note of this comment from Obina Ibrahim, who says, I think the request should come with a brief description of the initiative and expectations from those applying, including average weekly time requirements. And Obina adds, I think educational stakeholders are key in adolescent vaccination, like HPV vaccination. Both very good points. Thank you for those. Okolo Onini says, my boss will surely support me. I work with the public health department working on the control of HIV and TB, so it's all about the community's health. So there would be very interesting to think about how immunization fits in with HIV and TB work that you do. Anu Rotimi will share with the program within your team. That's wonderful. Mobilize people within CSOs, especially the increase in the infodemic. and Dr. Manir Ahmad, because immunization is the most cost-effective way of preventable disease prevention. Yes, indeed. All right, so yeah, so this question too, if you're not ready to answer right away, do think about these questions. These are going to be important questions because we are going to launch a campaign and to reach more health workers beyond the circles of that have already participated in TGLF initiatives. And you are the ones who know your colleagues who can help us figure out, so we can figure out together how to reach them. And then this is a key question also for your consideration, which is for your immunization challenge, how do you think learning from others can actually help you? If you are not able to answer this question, then please do not apply for this program, because it is about peer learning, which means it is going to be about learning from each other. If you're not clear in your mind why you want to learn from others and what you want to learn from others, then this is not a program for you. So this is, again, on the one hand, we do want to grow. Okay, I see two Rabius with raised hands. Let me go there. Yeah, please go ahead. And then while Rabiu is working on this microphone, Ismail Sidi Ali says, how long will the program be? So 2 weeks, and we shared the, and I see Charlotte was getting ready to answer that, from the 15th of July until actually, I believe it's the 26th of August, but we'll have a commencement event really to recognize and honor everyone who has made it to the finish line, who's earned the certificate on the Monday, 5th of August. Did you want to add anything to that, Charlotte?
No, rather, it was really just that it's a 2-week exercise and with a commencement event ceremony. Yeah, Rabiu, go ahead. Your microphone was unmuted. Okay, yes. Do remind us who you are, what you do.
Okay, thank you. I think as we all aware of the teamwork and collaboration with other colleagues during the work, either at the facility level, at the community level, at the district, or at the state, or even at the national. So I think our commitment to this will also go together as in a learning piece to what we have, what we know to learn. We will know what we didn't know from others, and we will all learn from the team. And initially, when we identify some of the gaps and challenges from the previous experience, so during that one, we'll share with the other colleagues, and by God's grace, at that very moment, the positive outcome will guide us to deliver all ourselves. And sometimes when you share your experience, others that have the same experience, before they will share their own, when the mitigation plan has been developed in that, and it will serve as a guide for all the team to achieve the positive result. Thank you.
Thank you, Rabiu. That's a great description of the value of peer learning. What I did not hear in what you said was, how is it going to help with your challenge? But we'll come back to that if you participate, and I hope you will participate in the program. Now, we will ask you when you apply, and again, if you are attending these meetings, helping with dissemination, you are guaranteed a seat in this initiative. But we do ask you in the application to agree to a number of shared commitments. First is a commitment to confidentiality. So what in the UK they call Chatham House rules. So you don't name individuals, organizations, or regions, I guess, or countries when sharing information. And that is so that within the context of this exercise, of this peer learning exercise, we are able to share freely and trust each other. So that is key. The second thing is, and all of you, I believe, in this room have already made a commitment to what we call the Scholar Pledge for Immunization, and you can see it here on screen. So it's really a pledge for the health of children and families in my country and everywhere. And then we do ask you to commit to basic principles in line with the recommendations of the World Health Organization and in line with the goals of Immunization Agenda 2030. So those are some of the commitments we will be asking you to make or reiterate. Now, here our question is, what else do we need to include in these commitments? So I'm again going to lower all the hands. And again, if you'd like to come in on any of the questions we've asked up to this point, I realize there are a lot of questions. Please do so. Rabiu, let's give others a chance if you. And in particular, we are again calling on women ambassadors and scholars to contribute. Charlotte, who are you going to unmute?
Trying to, and I'm just okay.
Hi, Tina.
Tina.
Hello, Rita. Hello, Charlotte. Hello.
Yes, Tina, we can hear you, and it's great to reconnect with you. I saw your message in the chat. So can you just introduce yourself again for colleagues and tell us what else you need these commitments?
Okay, thank you, Charlotte. My name is Tina. I'm from Kano State. I'm a social behavior change facilitator working with UNICEF. I'm a member of the Geneva Learning Foundation for more than 8 years. So I'm happy to be here with you. Actually, the call for collaboration to improve vaccination for Nigerian children is very impressive. We have some challenges. We have been doing very well. You know, Nigeria is very large. We have a lot of places that we still need to reach. And so with us being here as a team from Nigeria, I'm hopeful that we are going to be close with each other with the peer learning group that we are trying to create to be able to identify most of the states that are actually having high number of missed children, like my colleague was talking about Borno and other places. If we actually work as a team, we can move together to see some of these high risk areas that we have missed children to support as a team there. So I'm looking forward to participate in the collaboration and help to solve most of the issues that were identified so far. Thank you, Charlotte. So, thank you. Over.
Thank you, Tina. Thanks.
Yeah.
All right, and I think I take note of some of the great comments in the chat, and thank you for those of you who are taking the time to write those comments. From Juliette Obaya Julu, who says, immunization officer in your facility, you're a nurse by profession, and you say, this movement personally resonates with me because it sparks the passion I have in ensuring all children are fully immunized. So Juliette, you must know who are the other nurses, the other health professionals around you who share that passion, who share that spark. And what we're going to be calling on scholars of the Geneva Learning Foundation, those of you who already know us, is to go to your colleagues who do not know, or who you told them about it before, but they did not join, they did not participate for whatever reasons. And if you have insights into the reasons, then please do share that. But and we're going to be doing everything we can so that by the time we start on the 15th of July, we see a critical mass of health professionals. And you will be, because of your prior experience, because of your roles, the leadership that you've already exercised in the movement for Immunization Agenda 2030, or as TGLF ambassadors, you are likely to be amongst the leaders of that community and will be setting the example. But it's very important to emphasize that not everyone is like you. If you are in this room and you were invited to join this meeting, it is because you are exceptional. You have distinguished yourself through your participation. And we need to figure out together how to reach those who are not as exceptional as you are, and how to inspire and motivate them and help them, prompt them to action in order to actually make progress, make tangible progress at the end of the day. So
yeah, Reda,
to speak it,
the comment. Reda, sorry,
Yeah.
there's a comment in the chat from Chinyere Blessing that I think is worth responding to or commenting to. Say it is awesome that this is Nigeria specific. This peer learning exercise should be extended to service providers as well. So I just
Yes,
wanted
and
to
so
come back to initially that it is for everybody, especially those who are at the community level, directly first people to get in contact with the communities that are in need of immunization services.
And Ukamaka Okafor, so in the application, we'll be asking everyone for their location. And so we'll be connecting all of the successful applicants to each other and encouraging you, if you so choose, to meet and connect with colleagues from your area. Now, what are we actually going to do in this peer learning exercise? We're going to move very fast. And when you apply, we'll ask you to identify a local challenge, and we'll ask you to dig into the root causes of this challenge and map out corrective actions. So for those of you who participated between the 7th of March and the 20th of June in the first full learning cycle, this is the methodology with improvements because of what we learned from that experience, and because of the connection we have with both UNICEF and NPHCDA. So these are the specific steps. So many of you already know the steps. So we'll be looking to you to lead by example and to support newcomers, people who have never done this before, who've never been asked to think about root causes in particular, but including those who are the planners or who do this every day, but we'll be doing it connected to each other across boundaries of system level, of region, of state, and so on. There will be another aspect, which for those of you who participated in Teach to Reach 6, you may remember that we worked on improving your interpersonal communication skills. And so this is when, think about a time when you talk to someone about vaccines, and we'll be using a resource from UNICEF, a guide to interpersonal communication, and inviting you to test it, put it to the test, and see if and how it can actually help you improve your practice when dealing, for those of you who deal with caregivers. And we realize that not everyone directly interacts with caregivers in the immunization system, but we'll be working specifically with that group on this set of issues. And great, Ukamaka, we encourage scholars to make connections with each other. We do not need, we welcome nothing more than that. And we know that many of you have formed bonds of collaboration professionally, but also bonds of friendship. And we very much hope that this will happen with this exercise. Now, will you get a certificate? Yes. And the criteria for certification are spelled out here. Of course, we will share the slide deck. And so what you'll earn is a competency-based certificate. And this is a multi-level certificate system. So each time you complete an activity, you will earn a certificate at a higher level. So I see a question, which is a good question. It's actually, so is the foundation, this is from Kasim Musa, is the foundation committed to support immunization implementation and scale up in Nigeria after the peer-to-peer learning? So that, of course, is the government's responsibility. And what we wish to do with UNICEF is by introducing an innovative methodology to see how it can complement existing activities to support capacity building, capacity development, training, and to see how we can contribute to strengthening those efforts. And also how you, Kasim, as a leader in Nigeria, we know you because of your participation in the past, how you and others can help make that commitment, turn that commitment into reality. So next is, what other questions do you have? So I think we are seeing many of the questions. I'm going to just interrupt me as rudely as you can, Charlotte, if you see questions or comments that should be shared.
Yes, Reda.
And so the one thing we want to emphasize is we know you are busy. And you remember, for those of you who participated in the movement for Immunization Agenda 2030, we know that you're short on time. And so the way we develop, this is in-service training. So the biggest challenge for working health professionals is, where do I find the time to learn? That's problem number one. And problem number two is, if I learn something, what do I do with it? And so this, with peer learning, there are no time-consuming tasks, no homework that we ask you to do for its own sake. Everything we'll ask you to do, invite you to do, is focused on actually helping you with the activities, with the work that you do, and with the goals that you have. So what your boss is asking you to do, what the Ministry of Health is asking you to do, your participation in this initiative, should your application be accepted, but everyone's application here is going to be accepted, will be if you get this right, if we get this right together, this is going to help you with your work rather than create additional tasks and responsibilities. And as someone pointed out, we will definitely be spelling out the time requirements and the many flexible options, because most tasks can be done at any time, but there are strict deadlines. And again, this is like the full learning cycle that we ran in between April and June 2020. Now, the requirements also, there's a technology requirement, which is that you need a reliable internet connection. And we know that can be difficult in Nigeria, both because of the connectivity challenges, but also because of affordability challenges. So we are well aware of these challenges, but we know that thousands of Nigerian health professionals have participated in past initiatives. So yes, we know it is possible. When someone decides that they want to participate, they usually can. And we'll be certainly trying to see how we can support those who have those challenges. How much time is required? So to develop your own project, at least 2 hours over the 2 weeks, 2 hours to give feedback through peer review and supporting colleagues, and at least 1 hour to improve your project. That is the minimum requirement of 5 hours. Beyond this, really, each of you will choose how much time to put in. So we'll have live sessions to help you develop your project, to work with others on problem solving your challenges, to discover each other's challenges. And those live sessions have a problem, is that they require you to be connected to the internet reliably. If you cannot connect, what you can do is summed up in the following steps. Is to get the link for the recording, focus on your project offline, what you can do on your own device without needing any connection at all, and then make arrangements to submit your project online and to do peer review, because you will absolutely need internet for those two tasks. So the timeline and structure, and I think then we'll hope to leave a few minutes. So I showed in the introduction when we opened the pre-launch schedule. So this is really this is actually the launch campaign. And there's a few things here, which we'll be updating. So we are, okay, and this also needs to be updated. So so in addition to the call for applications, we'll be launching a call for local partners. So some of you have received such a call, Teach to Reach 10, which is coming up in 10 days. And so we'll be inviting your local organization, and that can be both a government service. So if you work in a health center in the facility and would like that facility, not just you as an individual, but the facility to be a partner in this initiative, we'll be making that possible. It'll be as simple as filling out a form and making sure you have, of course, the authorizations required. Yes?
There is a question in the chat from Dr. Mary Ojonema Onoja Alexander that says, if you have participated in the Geneva Learning Foundation certification for the full learning cycle, is there a need to participate here again?
Well, Dr. Mary, if you have solved your challenges for immunization where you work, and there are no unvaccinated or under-vaccinated children, if the community fully accepts and trusts vaccines unquestioningly, and have solved any other problems you may be facing, including cold chain, logistics, and so on, then you certainly do not need to participate again. But if you are still facing specific challenges and would like the help of your colleagues from all over Nigeria, in this case, in tackling these challenges together, then you certainly should participate. The difference here is really, this is the first time we're able to entirely focus our efforts on Nigeria. And I think there is something really, there's a lot of potential there. In terms of the level of certification, this will be at a higher level than what you earned in the full learning cycle in 2022. But that's a really important set of questions. So you can see the schedule here, and we'll be sending out letters of acceptance on the 8th of July, and we'll be launching the exercise on the 15th. So you can see here the key dates for applicants. So these are the dates to share with your colleagues when you engage them, or with members of your organization, if your organization chooses to become a local partner. And then the actual key dates for learners. So we'll be running this during the summer. We know some of you may have other commitments during the summer. It'll be really for each person to decide if they wish to participate, starting with the application process, because that completing the application is required, even if you are guaranteed a seat. And then I did see a question, Charlotte, about, I think it was in the Q&A. Right. So that was Kasim Musa's question. Our commitment to supporting immunization implementation and scale up. So, and then I see a question from Ismail Sidi Ali. How long will the program be? So I believe you've had the answer to that question. So from the 15th of July until the 26th of August, but we'll be having a commencement event on the 5th. So in principle, you'll have finished all your work in relation to the exercise by the 26th of August. Now, what happens afterwards? Our partnership with UNICEF is a long-term partnership, initially for the duration of 4 years, and so we certainly hope that there will be other activities offered with UNICEF and NPHCDA in Nigeria. In part, that is going to depend on you. If we are successful together in mobilizing health professionals and working together to tackle these challenges, then I would say that it's relatively, there is a high probability that there will be a follow-up to this exercise. If conversely, there's actually very little interest and no need for learning from each other, from connecting with health workers, health professionals all across the country from different system levels. If there's no need for that, then we certainly will not do it again. And we're trusting you, relying on you to tell us to what extent this can help you or not. So we have just 7 minutes remaining. I do want to, would be great to hear a few more voices. Do raise your hand if you would like to speak. So, right, I see, yeah. So there are 4 next steps. First is to register your interest. You won't receive the application right away. You will receive basically a placeholder for now, but the application is coming soon. Second, we'll be sharing in an email the links to share the call to action, so the official announcement, so we can spread on social media, spread on WhatsApp. And we know some of you are particularly good at really excel at doing that. And this time, not just share on WhatsApp, but actually talk to your colleagues and spend, and really help us figure out what the best ways are to communicate with your colleagues who may be like you, meaning truly dedicated and committed to immunization, but maybe not. And even if they're not as committed as you are, they can still benefit from participating in this initiative. Step 3 is to attend Monday. So the coming Mondays we'll be doing at this time, we'll be coming together for the next, for really the next actions, let's say. We'll be doing some activities together. And then step 4 is really to apply as soon as the application is available. So Charlotte, we have 5 minutes left.
Oh, yes, Freda. And we have a hand raised from Usman Mohamed Tuku.
Hello.
Sorry, Usman, unmute yourself again then.
Hello, Charlotte. Are you hearing me now?
Yes, loud and clear. Please introduce yourself.
Okay, thank you so much. My name is Usman Muhammad Chugul from Nigeria. I actually wanted to say thank you for this kind of event. I really appreciate for the whole effort you are making toward this. My question to Reda, apart from we that we are participating here and our colleagues that are working in one way or the other in immunization issue, can we invite those people who are working locally in the community, or let's say like village heads who are involved directly or indirectly in immunization issues to attend this kind of events, and other local CSOs that are ready to support movement for immunization? Can we invite to join such kind of program? Thank you.
Yes, the short answer is yes. And we will do everything we can to support their participation. The barriers that we know are connectivity, affordability, and literacy. People do need to be able to read and write in English. They do need to be able to connect, to have a reliable connection to the internet. So if there are barriers, if you can overcome these barriers, that would be amazing. And we would support that and honor that and recognize that and show that health workers can not only represent themselves as trusted advisors to communities, but actually facilitate community participation in tackling these local challenges that affect, first and foremost, members of the community. So that there could be something truly remarkable, because this is a movement. This is not about the Geneva Learning Foundation or about UNICEF. This is about really children and families. And we want, if we can figure out how to, in practice, make that truly open and inclusive. So the first affected, the most affected are part and parcel of this initiative. That is very much what we would like to see happen. And again, we will do everything we can to support that.
Okay, thank you so much, Reda.
Okay, thank you very much indeed. I hope this briefing has been clear and useful. Is there anyone else, Charlotte, we should hear from before we close?
So far, I'm not seeing any other hands raised, no comments or questions.
Should we introduce? Should we ask? So Jenny Sequeira, who many of you remember from the movement, but also she spent a significant number of years living and working in Nigeria. We're hoping that she'll be able to accompany us during this this exercise. Jenny, would you like to say a word before we close? And then probably there are many in this room who already know you.
Sure. Thank you, Reda. Thank you, Charlotte. I'm really looking forward to reconnecting with some of you and hearing your updated stories. I recognize many of the names in the chat, so wonderful to rejoin and to have this focus on Nigeria. I think with it having so many unvaccinated and under-vaccinated kids, it's a really important thing to hone in on some of the specific things to Nigeria and the context. So happy to join this this endeavor.
Great. Thank you very much indeed. All right, there is one thing. No, actually, we're in the webinar, aren't we? I wanted to unmute everyone, but I'm not. Okay, I'm not able to do that. So thank you very much indeed, Jenny. And we look forward to seeing you this coming Monday. So 1 week from now, we will reconvene. In between, you can expect an update, including the call to, so really the call to action to disseminate the very first initial announcement that you'll be able to spread on social media, on WhatsApp. We're also thinking of doing an actual poster, something you can print out and post in your facility, in your office or around your office. Let us know if you think that would be useful. We can certainly do that. But we really want to reach the next concentric circles around you, people who are may not be as dedicated or committed leaders as you are, as we know you to be. but who have in their hearts the willingness to make a difference for children and families. And so look forward to being in touch this week. Do come back to us with questions, feedback, comments. We welcome, and we see you also as critical friends. If we're getting something wrong, if we need to do something differently in order to do better, let us know. Thank you very much. And thank you as always to Charlotte. And wishing you a productive week. Yeah.
Thanks everyone. Thanks Jenny, and looking forward to reconnecting next Monday. But in the meantime, potentially via email and other social media platforms of the Geneva Learning Foundation.
Right.